A poll showed that Americans' top two financial worries are one, having enough money for retirement, and two, how to pay for a serious illness or accident. To show us how to find peace of mind with the right post-retirement insurance plan, Senior Vice President of Physicians Mutual, Bob Gunia, and also joining the conversation, our family member and pet adoption specialist, Suzanne Browning. Thrilled to have you guys here.
Welcome, guys.
Thank you.
So, Suzanne, you know this all too well. Medicare. Medicare is a big deal. This is your business. It can be very confusing. Suzanne, you took care of your late mother, so you had to navigate that entire thing on your own. What are your concerns for your own family that Bob can help you with?
Well, for my own family, I saw how devastating a serious illness can be, and I want to make sure that I'm prepared as well. I did get Part A when I turned 65, but my husband's going to retire soon, and so I need to know what my next step is for myself.
Susan, it's so good that you're here because you give testimony to the folks, the sons, the daughters that are helping their parents navigate retirement and the healthcare needs. What we all need is an advocate, someone that has gone through the transition before, that can help us so that when you're in a situation, when you have that medical episode or event, that you don't go bankrupt. And so it's wonderful that you're here, and then with you and your husband, starting new plans as well in retirement, and I'm trying to understand the A, Bs, and Cs, and Ds of Medicare. That's important.
When do you transition, though, from private to Medicare?
The vast majority of Americans transition at 65. That's the magic age. And so when you turn 65, unless you've already enrolled in Social Security, where you're automatically enrolled, if that hasn't occurred, you need to sign up. And you have a window of opportunity. And that window of opportunity is you take your birth month, and you have 3 months after that and 3 months before in order to sign up for Medicare.
And that's it.
Wow.
There are other special enrollment periods, but by and large, that's the bulk of the folks going through that door at that time.
And who's eligible for Medicare?
All Americans are eligible for Medicare. There are some certain circumstances where you want to make sure that you enroll at the proper time so you don't pay penalties as you enroll in Part B. Suzanne did a smart thing. Many people in her situation who have a husband who has employer coverage, they only enroll in Part A because Part A doesn't come with a special premium.
Okay.
Now that your husband is thinking about retiring and moving away from his employer coverage, you need to think about Part B and enrolling in that. And the reason why she didn't is because Part B comes with a premium. And Part D, which is the other component of Medicare, prescription drugs, that has a premium as well. So you made a smart choice by waiting, but now's the time to take action.
Well, I'm going to get a Part F in this if I don't know about it, because Part A, Part B, Part D, there's so many parts, they can be really confusing. So can you walk us through this so somebody like me could understand?
And you're only getting an F because you're not familiar with
There you go.
It's not, it's feel good about it. Rocket science. You just need to become familiar. Generally speaking, Medicare is like any other insurance program where they have covered services. So Medicare will say, this is medically necessary for your care. If it's not, then it's not covered. As a part of what's covered, then within Medicare, there's Part A, which is the hospital insurance. And so that's a major component. That's what you've already enrolled in. And then there's Part B. It's Matt's old friends, the physicians. You're paying for the doctor services, the surgical, the medical equipment. And then, as we said earlier, Part D is for your prescription drug coverage.
So you mentioned Suzanne has Part A, but you mentioned there are premiums now with Part B and Part D. What would people expect for those premiums?
For Part B, today it's at $121. Now, based on your income, it is indexed. So you could pay a little bit more if you have more earnings coming in retirement. Part D depends on the kind of drug coverage that you need and the kind of particular program that you signed up. But beyond that, it's important to realize that you're paying the premiums, but then there's deductibles, there's co-insurance and co-pays that Medicare doesn't cover that can leave you vulnerable to major expenses in retirement.
And I know, Suzanne, you have a very particular question about supplemental insurance.
Well, I also have, I know that the supplemental, I think you're saying Medicare, and you have supplemental insurance to pay
Wraps
Medicare.
around Medicare, correct.
But then there might be other things like dental or vision. I have macular degeneration in my family. I have macular degeneration, so I always want to make sure that I have coverage for vision.
Yes. Yes. It's very important to know that when you talked about Medicare supplement, with those deductibles and copays and deductibles each year, you could be out roughly about 20% of the overall cost of your healthcare needs in retirement. And 20% is a lot. If you have a $100,000 bill, that's $20,000 that's on the insured. So it is important to have a Medicare supplement plan. But then you made a good point that beyond the services that even Medicare doesn't cover, most people think Medicare covers dental. care, routine dental care. It doesn't. And then for your particular situation with your vision, it's something you have to investigate because there are probably some aspects of it that Medicare would cover and then other aspects that a supplemental policy would be to your benefit.
But you could help me with everything.
Absolutely.
Great.
So I'm embarrassed. I'm a little confused even as a former doctor here. Exactly, we've talked so much about the doctor's fees and the prescription. What does supplemental insurance cover?
Supplemental insurance covers, for example, if you go into a hospital and you have to have a day in the hospital, automatically there's over $1,200 that you have to pay before Medicare kicks in. And if you're in the hospital 4 or 5 times in a given year, that kicks in every time.
Okay.
For Part B, they have a deductible that you have to pay as well when you see a doctor right off the bat in a given year. And then there's 20% of the cost that is shared with you. So when you buy that Medicare supplement policy, it takes care of all of those gaps in Medicare.
It's a lifesaver.
So I think the question a lot of people have, Bob, how do they choose the right insurance company?
You need to make sure that your partner is someone that's been in the business and has a proven track record. We've been supplementing Medicare since the very beginning, since 1965. And you want an insurance carrier that's going to educate, so you get that familiarity F, so you really understand before you purchase. And if you don't understand, walk away, because it's important you understand what you have covered, so there's not that misunderstandings when you're rushing to the hospital.
We've actually prepared some helpful resources you can download about post-retirement health insurance planning. You can find them on our website and at physiciansmutual.com.